We'll start off with the number of new cases. We have 29 new test positive cases today, bringing our total of cases in British Columbia to 1,824. That includes 755 people in the Vancouver Coastal Health Region, 760 in Fraser Health Region, 111 on Vancouver Island, 156 in Interior Health Region, and 42 people in the Northern Health Region. In addition, we have one new long-term care facility outbreak, the Hawthorne Park and Orchard Manor in Interior Health, where there's a single case at the moment, and outbreak protocols have been implemented at that facility. We also have two new outbreaks in acute care units, in the Ridge Meadow Hospital and Lions Gate Hospital, and again, they are both being actively managed as outbreaks in those facilities. That brings us up to 347 cases in long-term care, assisted living, or acute care in the province, including 217 residents or patients and 130 staff. We have, on the positive side, 10 of the long-term care facility outbreaks now that had been declared over the past number of weeks are now declared over with no new cases for 2 incubation periods. In addition, we have another community outbreak. This again is in a poultry plant, the Superior Poultry Plant in Coquitlam, where 2 cases have been identified as positive so far, but there is an ongoing investigation that is happening as of yesterday when the first case was identified. So ongoing investigation and testing by Fraser Health. This is a sister plant to the United Poultry outbreak that had been announced earlier this week, and there continues to be an investigation at that plant with 29 people identified as COVID-19 positive associated with that outbreak. We are now at 78 cases of COVID-19 positive inmates and staff at the Mission Medium Institution, the federal correctional institution, that we continue to work in collaboration with Fraser Health in the province and Correctional Services Canada to manage that very challenging outbreak, and that we expect to be ongoing for some time. Of our cases, 103 are in hospital currently, and of those, 44 are currently in critical care or ICU care. We have an additional 4 deaths to report in the past day, bringing our total of people who've died from COVID-19 in British Columbia to 94. That was 1 in the Fraser Health Region and 3 in Vancouver Coastal. And our condolences and our thoughts are with the families and the care providers and the communities who have lost these people. We have 1,092 people who have fully recovered as of today. We've been talking this week about, what does the future hold since we presented some of the modeling. And as we are seeing around the world, and is becoming very clear to us, we are going to be living with COVID-19 in our communities for some time. And we need to develop our way of managing that and living with that. And we've seen some examples of that around the world as people are coming into the second phase. And when we think about the peak of our epidemic, that's sort of the halfway point. And in several places around the world, including here in Canada, we're at that or past that halfway point. We have been fortunate in many ways in British Columbia in that we have not had a dramatic increase, that accelerated upswing that we saw in many other places. And much of that is due to the way that British Columbians have responded together to keep their distance and to do the things that we need to do to try and manage this in our community here. And we need to continue to look at how we manage our pandemic in British Columbia. And we manage that risk going forward by opening up industry, by opening up our hospital system, but doing it in a way that includes vigilance and careful thinking. And it doesn't mean that the virus is going away. So we have to learn how do we live with it without getting ourselves into trouble, without getting one of those explosive outbreaks in our province. We need to start doing that. We need to reach a manageable number of new cases. That doesn't mean that we have to have no cases every day for a number of weeks. We need to have a manageable number. We need to have a number that we can identify quickly, that we know people who are getting sick are getting tested, that we can manage your isolation of contacts so that people who have been exposed, if and when they become sick, get the care they need, but also do not pass it on to others. And we need to manage these clusters and outbreaks that we're finding in our communities. So that is our challenge, all of us, in the coming weeks, so that we can increase our contacts, we can increase our social connections, and we can increase our economic connections. It is a very careful balance, and it's going to be difficult for us to find that. But we also know that we can do this. We have had many essential industries that have continued, and we have put in place guidance to help us manage those industries in a way that protects both the people who are working, but also our families and our communities that we connect with. So it depends on us doing our part, even as we loosen restrictions in British Columbia. One of the examples that we have, we've developed an order, a public health order, that refers to, that provides direction for agriculture, aquaculture, forestry, and resources. And it includes how do we manage those industries, those important essential things that we need in British Columbia in a way that protects all of us. And it includes guidance that will be posted in the coming hours, I think, as well as things like appointing an infection prevention and control coordinator for these important types of sites where we have people working and living in accommodations and common accommodations. We've learned from the outbreaks that we've seen. We've seen temporary foreign workers have experience with an outbreak of COVID-19. We've seen it in most recently in the poultry plants. We've watched what's happened in other places in northern Alberta, for example. So we are taking those learnings and we're applying them to our situation as we move forward here in British Columbia. And this is what we all need to think about. What does it mean for me, for my business, for my industry, for my sports? How do we as a family connect once we start having some leeway with restrictions? But we need to be very careful, and we need to be thoughtful about it, and we need to consider what we are doing and how it's going to impact our family carefully. A misstep in the wrong direction puts us all at risk, because we have seen how quickly this virus can take hold and can be transmitted and cause serious illness and hospitalizations and unfortunately deaths. So we need to think in the coming weeks about the widening our personal circles. We've been talking very much about how important it is for us to stay home, to have our connections be our family, our households, and to minimize those connections with people outside our households. As we expand our roles in the coming weeks, if we expand our circle, we have to do that thoughtfully, and we have to be aware of who in our circle is more at risk of having severe illness. So if I am going back to work, perhaps I need to be careful about who my children are going to go on a play date with. It may be more important that they spend time with their grandparents, that their grandparents are able to care for them when I'm going back to work. And it would mean not having that play date, because then you're exposing your child to the connections of those connections. So it's all complicated, but we need to think about this for our own family, and we need to make those judgments about what's important and how we can manage the risk for ourselves, but also for our community and for our province. And we will be providing more guidance, and I think we need to look at what we have done so far as examples of how we can do this safely. And we have a very limited room to do that. So those are the things that we'll be talking about more in the coming days, but I want people to think about it now and think about the impacts for our own families and our own communities. I also want to say that this is not forever. It is for now, and now may be months, it may be as long as a year, but there is a light at the end of that tunnel, and we have shown that we can do this. We have shown that in the last few months. We will get through this storm working together in the best and safest possible way. Now is not the time to tip the scales against us with careless action. It's the time for patience and for resilience, and to face our pandemic here in BC together, calmly and being kind to each other and staying safe.